stools and urine, respectively. The examiner will come back to you and refer you back to Mrs. Horn and say to you, now that you've said to me that the cause of Mrs. Horn jaundice is 75% due to biliary obstruction, tell me a little bit about biliary obstruction. In your own words, briefly. You told the examiner that we divide biliary obstruction into two, don't we? Extra and intra-hepatic biliary obstruction. Now the extra-hepatic biliary obstruction is different, isn't it? Because it is surgically or endoscopically accessible to treatment. So you can cut cancer surgically, or you can cannulate into the tumours and deal with them in that sort of way. But if the obstruction is further up in the liver, in and around those biliary caniculli that I showed you earlier on, then you can't do that. So it's important to remember some forms of biliary obstruction, intrahepatic biliary obstruction, are not accessible to surgery. And you remember the causes. Well, at least one of the causes. And if you really want to impress the examiner, two of the causes of intrahepatic biliary obstruction. And the first thing which comes in mind is drugs. Yes, that's right, drugs. And there is about 15 or 20 different drugs which are known to be associated with intrahepatic biliary obstruction. Drugs such as cyclosporins, drugs such as chlorothiazide, even simple things like amoxicillin and clauvcanic acid, and even antidepressants like the tricyclic antidepressants, where the picture is of biliary obstruction. And it may mimic a cancer, a hepatomaand, a malignant tumour of the liver cell. And you may wrongly suspect that the patient has a serious, terrible, killing disease, but all they have done